Welcome to our channel. Today, we're diving into a critical health topic that everyone should be aware of: hidden dangers, top warning signs of blood clots you need to know. Blood clots can be a silent threat, and recognizing the warning signs could save your life or the life of someone you love. Stay with us as we uncover the hidden dangers of blood clots. So, what exactly is a blood clot? A blood clot is a clump of blood that has changed from a liquid to a gel-like or semi-solid state. While clotting is a necessary process that can prevent excessive bleeding when you're injured, clots that form within your veins or arteries can be dangerous and lead to serious health problems. If left untreated, blood clots can have severe consequences. They can block the flow of blood, potentially leading to life-threatening conditions such as stroke, heart attack, or pulmonary embolism, where the clot travels to your lungs. Understanding and recognizing the signs of blood clots is crucial for prompt medical intervention. There are several hidden risks associated with blood clots. They often develop silently and may not cause noticeable symptoms until they have caused significant damage. Individuals who are immobile for long periods, those with certain medical conditions, or those who have undergone surgery are particularly at risk. But how can you tell if you or someone you know is at risk of a blood clot? What are the warning signs that you need to watch out for? Blood clots can be caused by a variety of factors. These include prolonged immobility, like sitting during long flights or car trips, certain medical conditions like cancer or heart disease, surgeries, injuries, and even lifestyle factors such as smoking and obesity. Understanding these causes can help you take preventive measures. Stay tuned as we delve deeper into the top warning signs of blood clots that you need to know and what you can do to protect yourself and your loved ones. Don't forget to hit that subscribe button and click the notification bell so you never miss out on our vital health tips. Let's get started. Blood is constantly flowing and in motion throughout the body. The heart pumps it through your arteries and then it's returned to the heart. Without constant motion, blood can become stagnant, which results in clots. Before we get into the warning signs, the risk factors, and blood clot prevention, we need to talk about deep vein thrombosis. Deep vein thrombosis, or DVT for brevity's sake, is the name for when a clot forms in one of the major veins deep inside your body. Mostly, it'll happen in your legs, but it can also happen in your arms, pelvis, lungs, or even your brain. There are at least 900,000 Americans affected by these every year. These are the most serious of blood clots and should be examined by a medical professional immediately. Now that we've gotten deep vein thrombosis out of the way, let's move on to the rest of our guide to blood clots. 2. Risk factors for blood clots. Before we look for warning signs, we have to ask ourselves, what are the risk factors? 1. Age. If you're 65 or older, you're much more at risk of blood clots. Keep an eye out for these if you're a senior. 2. Traveling, especially lengthy travel, such as any trips that cause you to sit for more than 4 hours at a time. They make you much more susceptible to blood clots. Try to keep your blood flowing at all times. Even if you're on an airplane, walk down the aisle and try to talk to other passengers. 3. Sedentary lifestyle. Lying around or being sedentary for long periods makes you a lot more likely to get a blood clot. We know how awesome it is to sit around and watch Netflix for 8 hours a day, but try to move around at least a little. 4. Obesity. People who suffer from obesity are very prone to blood clots. If you're thinking of changing your weight, we here at Bestie have a lot of cool videos about weight loss and dieting. 5. Pregnancy. Pregnant women are incredibly susceptible to blood clots. 6. Family history. If you have a family history of blood clots, make sure to talk to your other family members to see if they've ever suffered from them. If so, talk to your family doctor. 7. Smoking. Smokers have a bigger risk of getting a blood clot. If you do smoke, quit or at the very least cut down a whole bunch. 8. Birth control. Certain birth control pills can cause or at least contribute to blood clots. Talk to your doctor about what the side effects of your pills are. 2. Warning signs of blood clots. Now that we've talked about the risk factors, keep watching to see what the top warning signs of blood clots are. 1. Swelling. If a blood clot forms in your arms or legs, deep vein thrombosis, you could experience swelling. DVT is more likely to occur if you've had surgery, don't move often, or if you've been on a plane for a while. 2. Color change. If you notice that an area of your body becomes itchy, turns red or blue, or has a red streak, you may have a blood clot. The change in color suggests that the area is tender and swelling. 3. Pain. Your limbs need circulation in order to move. When it's cut off, due to a blood clot, it can cause inflammation, leading to acute or severe pain in the affected limb. 4. Breathing issues. This can mean that the blood clot has moved from your arm or leg to your lungs. You may experience a rough cough, cough up blood, dizziness, and chest pain. If this happens, get medical treatment immediately. 5. Racing heart. When you have a blood clot in your lungs, your oxygen flow slows down. This causes your heart rate to speed up to make up for the slow oxygen flow. 6. Speech or vision issues. A blood clot in the brain can be caused by fatty deposits in the blood vessel walls that deposit blood into your brain. This can cause vision and speech problems, seizures, and a feeling of weakness. 7. Nausea or vomiting. A blood clot can occur in the veins that drain blood from the intestines. It can cause nausea, vomiting, blood in the stool, diarrhea, and stomach pain. 8. High blood pressure. If you have a blood clot in your kidneys, it can keep them from removing waste. This can cause kidney failure or high blood pressure. You may also experience a fever, blood in your urine, trouble breathing, and sudden leg swelling. 3. Prevention tips. Finally, let's ask ourselves, how does one keep from getting a blood clot? Luckily, we've consulted a myriad of sources to teach you the do's and don'ts of how to prevent blood clots. 1. Wear loose-fitting clothes. As we said, blood needs constant motion in order not to clot. One of the ways to keep your blood flowing is to make sure that your clothes don't restrict any of your limbs, especially your legs. We know you love wearing those skinny jeans, but maybe restrict them to once a week. 2. Raise your legs. You should raise your legs 6 inches above your heart from time to time. This will help you move your blood around a little and, best of all, prevent it from clotting up. 3. Exercise. Everyone compares exercising to getting the blood flowing. Yoga and deep breathing exercises are great ways to boost circulation. Walking can also strengthen your heart and improve overall cardiovascular health. We can also assure our viewers that exercise in general is great for blood flow and thus great for preventing blood clots. 4. Change your position often. We talked about this briefly in the risk factors, but if you're sitting or standing for a while, you should switch around. This will get all those juices that keep your body going moving around. You should never sit or stand for more than an hour. We know you might look silly bopping up and down every 60 minutes, but at least it's better than getting a blood clot. 5. Eat less salt. There's a correlation between bad circulation and eating salt. Excessive salt intake can also increase stiffness of the arteries and cause ventricular hypertrophy, an enlargement of the heart's muscle tissue, making the heart pump with less force. So just cut down. 6. Protect your legs. We're already aware that your legs are in the most trouble, especially when it comes to getting deep vein thrombosis. So you're going to want to protect those babies at all costs. Do your best not to bump or hurt them, and especially don't cross them. Either way, you're going to be cutting off circulation if you cross them or focusing too much blood to one area if you bump them. Just keep an eye out and be careful. 7. Stop smoking. Smoking raises the risk of unwanted blood clots and makes it more likely that platelets will stick together. Smoking also damages the lining of the blood vessels, which can cause clots to form. All in all, there are plenty of resources online, and if you're really struggling, ask your friends and family for a hand. Understanding and preventing blood clots is crucial for maintaining good health. By recognizing the warning signs and managing the risk factors, you can protect yourself from serious health issues. If you have any tips or experiences related to blood clots, share them in the comments below. Don't forget to like, share, and subscribe to our channel for more health tips. Explore our other videos by clicking on the options to the left or right. Thank you for watching.